Hey everybody, welcome to the Med Legal Greenroom. I am Sam Frentzas, co-founder of the Driving Force Company. And today's guest is a true leader in spine care and someone who spent, his entire career helping patients find answers, regain function, and make better informed decisions about their health. Dr. Alex De Moura is an internationally recognized orthopedic spine surgeon and founder of the New York Spine Institute, one of the premier comprehensive spine organizations serving patients throughout New York and New Jersey. Dr. De Moura knew early in life that medicine, and specifically orthopedics, would become his calling. After earning his medical degree from Chicago Medical University, he completed his orthopedic surgery residency at Temple University Medical Center, followed by advanced fellowship training in orthopedics and neurosurgical spine surgery at NYU Langone Medical Center.
I know, yeah.
All right. In 1996, Dr. De Moura returned to Long Island with a vision. Bring the level of expertise he found to some of the world's leading medical institutions directly to patients in his own community. And that's where the vision for New York Spine Institute came from. Now, what makes New York Spine Institute particularly exciting is its 360-degree approach in spine care, bringing advanced diagnosis, including vertebral motion analysis, or VMA, physical therapy, interventional care, and advanced surgical options together with a coordinated patient pathway. And that's where our conversation really begins today. And where it gets really interesting, what happens when a patient is still in pain, but traditional static imaging doesn't tell the entire story? How can objectively measuring the spine in motion change the diagnosis, influence treatment decisions, and potentially improve patient outcomes? And as New York Spine Institute expands the use of the VMA, what it can mean the future of spine diagnostics across New York, New Jersey. So we're going to get into all of that. Welcome to the Med Legal Green Room, Dr. Alex De Moura.
Thank you so much, Sam. Pleasure to be here today.
Oh, it's fantastic. I've been to your facility firsthand. So it's not only is it the facility amazing, and that's easy to do, but the people that rally around, your staff. I got to witness spending a day there myself. Is what the culture that you build, the patient-centric forward, is pretty amazing. Everybody's in it for, hey, how fast we got to make money. I mean, your catering area, how they take care of patients with coffee, those little things that go an extra mile. So what you don't know is I was talking to people on their way out about their experience, and not only from the doctors, but all the way down to the staff, how they felt good about decisions they were making, how they were treated. That says a lot about the culture that you built. And to me, kudos to you, because it starts from the top to work its way down. So
Thank you.
I wanted to let you know about everybody hears about the bad. Let's hear about the good that happens with the culture.
I mean, essentially, I wanted to build a real comprehensive center, and we've accomplished that. We have three world-class spinal surgeons, myself, Dr. McCagno, and Dr. Timothy Roberts. We have offices in all the boroughs in New York, now expanding into North and South Jersey. But our Westbury office really is comprehensive. We have everything here from MRI, X-ray, physical therapy, pain management, office-based surgery, and just adding the VMA, just add one more facet that really can help us in the clinical setting.
And that's what our topic is going to be today. Beyond static imaging, how VMA is changing patient outcomes. So let's dig right into it. So why do you incorporate the VMA study into a diagnostic process? And what information does it provide that traditional static imaging may not provide?
Well, yeah, I mean, traditionally, X-rays and MRIs are essentially just like a little snapshot, right? We're not seeing anything dynamic. But VMA allows us to evaluate the spine dynamically. While it's moving, we're capturing the spine. It gives us objective quantitative information about segmental motion and can identify abnormal motion or instability that sometimes just not going to be there on a static study.
Okay, so when in the patient journey do you order a VMA study, and what clinical findings or symptoms make you consider motion-based imaging?
So, I consider VMA when a patient has persistent neck or back pain. There's symptoms. You're surmising there might be some instability that's not being picked up on those static studies. When the clinical correlation doesn't jibe with the static imaging, it's also particularly useful. Like, for example, when a patient comes in, they've had a major trauma, like let's say a roofer falls off a roof. You know, there's been significant impact. And sometimes it's not the impact like being evicted or ejected from an automobile in a high speed motor vehicle accident where you have a clear spinal instability with, let's say, a fractured dislocation. But in this instance, they've been injured on the workplace. There is segmental instability, and that's an excellent time. The patient has had plain X-rays, which didn't show any instability. MRI maybe shows a herniated disc, but it doesn't really correlate with their symptomatology. And you're surmising that there's been some kind of interspinous facet type damage, and the VMA is excellent for that.
Outstanding. So how does having objective quantified spinal motion influence treatment decision and ultimately improve patient outcomes?
So it takes the subjectivity out of the decision making. Instead of simply looking at an image and estimating movement, we can actually quantify. This is a digital system. It's taking digital images, and you have a neuroradiologist that's reading the films. So it can help you identify a specific level that has the abnormality and determine whether surgery is appropriate, and maybe even potentially avoid unnecessary treatment when the motion is normal.
And I know this has been a huge game changer for attorneys and even a lot of the chiropractors that work with you guys that send over their patients, because I guess if you have a foot and ankle problem, you're not going to chiropractor. But in their spinal decision, being able to partner and use you as a resource, not only for imaging, but obviously for bigger treatments as well. You've been a phenomenal resource for chiropractors to be able to help their patients as well. So I love that ecosystem that's being built around the spinal care and offering personal injury attorneys and chiropractors an opportunity, obviously, for the attorneys for their cases, but for chiropractors now to be able to have a resource to go to, not only for the imaging, but for the medical side of their needs working together. So that ecosystem is continuing to grow. And I know you've been fantastic about facilitating that. And I know your time is busy, so I appreciate you taking this time. But look, if you're an attorney looking for objective evidence that can strengthen your client's cases, or a provider treating patients whose pain generator remains unclear, don't settle for another best guess. Click the link below, schedule a VMA study, and see what static imaging is missing. Measure the motion, identify the instability, get the definitive diagnosis, and give patients the cases and answers they deserve. Dr. De Moura, thank you for taking time out of your very busy day today, going through the VMA. Again, if you're an attorney or a provider seeking for answers, click the link below and schedule your VMA study through the New York Spine Institute. Dr. De Moura, thank you again for taking time out of your day.
Thank you, Sam. Great seeing you. Have a great day.
Thank you.